welcome to the SBE Podcast series, where we discuss currently and economically relevant topics with our members of the network of academics and professionals. And today our guest here is Professor Dr. Gaby Odekerken Schröder, who is chair in customer-centric service science at Maastricht University. Furthermore, she is also an associate dean in internationalization and impact. And furthermore, she's also a member of faculty board at SBE. Welcome here. And I'm Dóra Gál, and I'm going to be hosting this episode today about service robots in the healthcare sector. So I already said a couple of things about your work, but can you also tell us more about how you've got here, what led you to do research in this area?
Hi, Dóra. Thank you so much. It's my pleasure to be here. I've been looking forward to our conversation today. Yeah, so how did I come here? How you want us to focus on healthcare today?
Yeah.
And I think it's important to share a bit of a personal story in that sense. So in 2010, our daughter was hospitalized with meningitis.
Yeah.
And at that time, I just realized as a concerned parent how important the entire healthcare ecosystem, but more in specific, the nurses at her bed are. Mm-hmm. They, in my view, they really make a difference in someone's life. And I have been passionate about services throughout my entire career, which is close to 30 years by now. And services span lots of different contexts, from hospitality to education to financial services, but also to healthcare. And at that moment, I realized probably I want to do something that gives me, more sense-making, more value to what I do. And I started working more on healthcare topics, also in close collaboration with the Health Service Research Group at FHML, showing completely different perspectives to the service environment. They are experts, and most of my colleagues, they are also trained as either medical doctors or nurses, and we come from different angles. And I think it's very enriching to look at one topic, one challenge from completely different perspectives. So that is a long story to tell how we got to healthcare, how we got to robots. In, I guess it was 2015 approximately, Dominic Marr, my colleague, and we got ourselves into an initial training network. Mm-hmm. So that is a big EU funding scheme where we, in collaboration with many other universities, got funding for 9 PhD candidates. And one of the PhD candidates was Martina Čajić. She's a very talented researcher from Croatia, currently working in Finland. But she was the first who really thought, well, probably these robots and then service design and innovation are an area to further explore. And she was our first PhD candidate who also formally defended her PhD in that direction. And that basically got the ball rolling.
Yeah, and what brought you to Maastricht? Because we also have here a Maastricht Center for Robots. Can you tell us also a little bit more about that?
Yeah, absolutely. So the Maastricht Center for Robots, I think, does what Maastricht University and our School of Business and Economics is well known for. It's really this triangle of research, education, and impact.
Yeah.
And so we really don't believe that these are separate silos. We think we have to integrate all three of them. And our Maastricht Center for Robots is really focusing on that. So what we study in our research is also something that we bring to our classes. And sometimes we even involve our students into our research or into working with our external partners. And by doing so, we also create impact. Mm-hmm. I strongly believe that as academics, as universities, we can no longer afford to be in an ivory tower.
Yeah.
And we are here with a purpose. And we have a responsibility to tackle societal problems and challenges, but also to develop knowledge that helps in solving or mitigating some of these challenges. And I think that is what the Maastricht Center for Robots does as a mission. So bringing this triangle to life.
Yeah, that's very nice. Usually, it's really hard to do triangulation in research because many parties sometimes don't understand each other. How can we move forward with certain topics? So it's nice that there is a center here, and it's more as a system. It works, but just going more into the service robots, can you also explain us what do we understand under service robots? Like, all robots in medical settings can be considered service robots, or are some limitations here?
That's a really fascinating question, and I think it needs tons of scholars to solve the scoping, definition, conceptualization question, if you will. But at the Maastricht Center for Robots, we really focus on embodied robots. And embodied robots are robots that you can touch and feel. They have a body. And we focus on robots that interact with humans. So typically in a triad with a user, and that can be a customer, it can be a patient, it can be a nurse, the robot, and then a formal caregiver or a service provider. So if we would talk about education, a service robot interacts between the student and the teacher. If we talk in healthcare, the service robot interacts between the patient and the nurse. So it's always a triangle. And what differentiates a service robot from, for instance, an industrial robot that does order picking and supply chain management, is that it can function relatively autonomously, a service robot, without constant intervention of a human, but it does collaborate with a human. So this order picking robot and supply chain management just works and does its thing, but there's no constant interaction with the human. If we look at a surgical robot in healthcare, then the robot is not autonomous. There's a surgeon constantly working with the surgical robot.
Yeah.
But if you ask me the question, can a service robot work in healthcare? I would wholeheartedly say yes and confirm that, because we're also doing research. So one beautiful research that we are currently conducting is in collaboration with healthcare insurance. It's in Dutch, it's called CZ. In collaboration with 6 long-term care providers for people that suffer from mental disabilities. And in collaboration with Robot Control, the ICT provider, Maastricht University, and in particular Maastricht Center for Robot and Zuid Applied University, built this ecosystem to implement social robots to individual patients. And you have to imagine how some people suffer from autism, as an example. They really benefit from a clear structure in the day.
That's true. Yeah.
And the nurse can program on a very individual basis what you would need as a patient suffering from autism. So it's important that you start your day. And the nurse could program in an Outlook type, very simple user interface. At 8 o'clock, wake up and make sure that she starts her day. So it would say, "Hi Dora, how are you? Did you sleep well? Make sure you get dressed because I want to play outside."
Yeah.
And many patients still have this feeling of responsibility, and they would take the robot outside. So that would be very helpful.
Yes.
But and the robot can also serve as a reminder, like, "Hey, it's almost 2 o'clock. Remember to go to your physiotherapist." So that is one example. And then we are currently testing with Sevagram, an elderly care organization, an award with patients that suffer from dementia. And there we work with a very simple design robot. It's a Prussian baby type of robot without a face, but it giggles and tickles upon touch. So if an elderly patient would pat the robot or tickle it, then the robot is responding. And we can really see that these patients calm down by having this responsibility of taking care of the baby. And really the most beautiful thing or touching thing is that the robot is also an enabler of conversations with others.
Yeah.
And so for many people that suffer from dementia, it's very hard to have social conversations. But by having the baby, we observed that this lady walked to the caregiver and really started talking about her baby.
Yes.
And even showing it also to a fellow resident. And so in that sense, service robots can definitely have a role in healthcare, but we are just trying to figure out how. And how do they complement the human staff.
And do you see also that like individuals could buy these robots themselves? So like we don't need a nurse, it's just elderly care. For example, let's assume there is like a 76-year-old elderly and a woman, and she has 3 cats, but she can't take care of them anymore that good. And there could be a robot that takes care of this. Can this also be as like a service robot? Can we also trust this that it's going to help the elderly, but also like it could be like deployed in a large scale, so it could be go on the market and people would buy it?
That's a very interesting question. So you are asking about more in the domestic setting.
Yes.
You already know that people buy domestic technology, like a vacuum cleaner or a pool cleaner. There are different types of robots that people already purchase to do chores, I would say. Things that we typically don't like to do, we outsource that to a robot. So that is there to stay probably, but that is not what we consider a service robot. We consider that a domestic robot. So if you would ask, do people buy robots to also take these caregiving roles? I can definitely imagine that. So this example of Sevegram that I just mentioned, after an informal caregiver, and in this case it was the daughter of a lady, saw what the robot was doing to her mom, she literally asked, can we buy one?
Yeah.
So I think that is already the answer to your question.
Yeah, okay.
It has not yet been embedded in our research, but there are lots of groups across the world experimenting with different setups, and I'm sure that this will find its way. And obviously there are lots of things that need to be arranged in terms of liability, in terms of ethics, and that is something that we also face along the way.
Yeah. At this point, many questions come to my mind, but like let's start with one that what is the perception of patients about these robots? Like for example, in a medical setting, so in a hospital, are they trusting these robots? So would they also take medications from these robots or vaccination and things like that? Throughout your research, how did you see that?
Yeah. So adoption is a very important and fascinating research theme. So who embraces the new technology, who does not? And I think like with any technology, it would be very hard to say everyone does or no one does. It's always these nuances, and for what purpose do they or do they not embrace or adopt the robot? And that is exactly what we are trying to figure out right now. What we do see is that that there is also a difference in the stage of implementation. So initially, some people might be very excited and very enthusiastic, and after a few experiences, this fades away. And then the novelty wears out, or the robot doesn't live up to their expectations, because the robot is not a human, which has advantages and disadvantages. Yes. It's never grumpy, it's never tired, it's available 24/7, but it probably also doesn't have the empathetic skills that a human does have.
Exactly.
So that would be one group. There's also another group of users who would be very resistant in the beginning. You can literally tell that they
closed
would
up,
act like this, closed up, and really feel like, no, this is not for me or for my patients. And because the user groups can also be the formal caregivers, like the nurse or a physiotherapist or whomever has the robot as a co-worker. And then the opposite might happen. So once they see how their patients work or are calmed by the robot, they become thrilled and enthusiastic and even apologize, like, sorry for my initial resistance, but I can really see what it does to my patient or my resident. And so these are things that you really see. We also work a lot And that's not in healthcare, but with Dada One. Dada One is a fast casual restaurant with Asian food. Was one of our first partners, and there they implemented robots from scratch. So in the pandemic, they said, well, we are no longer allowed to have a regular number of people in store. So let's try with robots. Then we have more room.
You don't have to lay them off.
Exactly.
In times of crisis,
to work with robots. And there, it actually happened naturally. So the robots were there. You might recall that there's a very young staff. They typically considered it almost normal that they had robot co-workers and they had to collaborate. And you can still question, how is training needed? What kind of training? For what type of tasks? How would you rather use a robot than a human worker? How can the robot support the human worker? Imagine that you have to serve a table of 18. Yeah. In that case, the robot can literally carry a lot of heavy stuff. And that would unburden the human employee to really have this deep attention for the guest, have an interaction. And that's wonderful, especially in a time of staff shortage.
Yes.
And so this was a long answer on your question, how do people embrace it? And I try to distinguish these three groups: people who are initially resistant and they become more enthusiastic, people who are initially open and wear out, and people who are neutral and just naturally work with robots. And we basically have 50 shades of gray, I would say, in how people adopt robots.
Yeah, of course. And but also here comes the question, if a robot doesn't live up to expectations or there's a misconduct, who is liable then? Is it the owner or the producer? Who is liable for such a thing?
Yeah. So liability ethics is a very important theme. Also now, with new legislation, it's crucial that these things are in order. In the end, we want to do good to the world, to whatever user. So in that sense, I think it's really crucial that we also train our researchers to be aware of these issues. At the moment, we make sure that in the healthcare settings, as that is the main theme you want to focus on, everyone who is involved also gives consent. We always get medical ethical approval of the bodies that are responsible for giving this approval. So we are very well aware of potential consequences. And in the example of the robot that comforts people who suffer from dementia, one potential threat could be that we have a pilot project.
And they forgot.
People like the project. Yeah. People like the robot. They bond with the robot. They even give it names.
Yeah, of course. Yeah.
And then we say, so now project is over, give me the robot. And you can't do that.
Yeah, exactly.
And they are attached. They build a relationship. How futuristic this might sound.
It is.
But people really bond. Yeah. And for those cases, we really try to define mitigation strategies of how can we overcome this potential risk. And in this case, the healthcare organization said, well, if we observe this, then we commit to making the investment for that particular patient. And that's wonderful. So these are all kinds of mitigation strategies that you have to be aware of.
It's like a Black Mirror episode. I don't know if you're familiar with this series. Yeah,
true.
It's like that. And but also, for example, usually robots have like a lower error ratio than human professionals, for example, in medical settings. So we can say that they're not going to get tired. Maybe they need a battery, but they're not going to get tired. So we can also say that, because usually we're more forgiving towards humans. It's more like, humans make errors, but robots shouldn't. And but can we say here that robots actually have a lower error ratio?
Yeah, there are different studies on error proneness of robots, also about forgiving, willingness to forgive by users. Yeah. There are still different types of research findings that go in different directions. I think a lot is also depending on how autonomous is the robot. If I give the example of this simple design robot that responds by giggling to the touch of an elderly, there's not so much that can go wrong.
Yeah.
One thing that went wrong is that an elderly person or a nurse, I don't even recall, put the robot in the dishwasher.
Oh.
Yeah, that's the risk of our research. That happens. No one got hurt. It's all good.
Yeah.
But this robot can literally not do harm to the resident using the robot. We are not yet experimenting with robots that are prescribing medicine. We only work with robots that can give a medicine reminder.
Yeah.
Like it's 8 o'clock.
Or bring it. Yeah.
Please recall.
Yeah.
No, not even bring it. Just recall to take your medicine. So we are very mindful of potential liability issues, but also about the limitations of the robot at the moment. So in the end, it's always the human who is responsible for the robot in the settings that we are experimenting with now.
Yeah. And so there is an initial investment when deploying robots. Usually, how long does it take for the investment to pay off? So, like, at first, it's probably going to be more expensive than hiring new professionals, but after a while, of course, it's going to pay off. Also considering maintenance. So, how long does it take usually? How would it take? How long would it take?
I think we need a mind shift in looking at the investment of robots. I think we should put robots on the payroll.
Yeah, okay.
They're not an investment. They are just a co-worker.
Yeah.
And if we take that perspective, they are way more affordable than a human co-worker.
Yeah, sure.
So some robots in hospitality, they cost 15,000 euros.
Yeah.
Some robots in healthcare, they even cost a fraction of that. And if they unburden human staff only by 10%, it pays off in months and weeks even.
Yeah.
In hospitality, with Data One, we learned that 2 robots can replace 1 human staff member. And replacing always sounds very negative because people become threatened of their job. They don't.
Of course, yeah.
Because we have labor shortage.
Yeah.
Restaurants close because we don't have enough people who can take a serving role. So here it's just a solution to a problem. In healthcare, we see that if a robot can do a fraction of what a nurse can do, this nurse can free his or her time for real attention to the patient.
Yeah, yeah. The social element, of course.
This unburdened social, but also highly skilled, like offering the medicines or any other treatment that the robot cannot do. So in that sense, I think the financial matter is the least concerning because it pays off straight away.
Okay. And when you say payroll, who would get actually the money when it's like on a payroll, the robot? Is it for maintenance then? Or?
No, I think if you look at it from a financial perspective, if you would have a ward with 10 nurses and now you add 2 co-workers, robots, to that payroll, to this overview of salaries, and who gets the money, that's obviously the robot supplier who has to be rewarded for purchasing or ordering this robot. But it's a mind shift, I think, mentally putting it at the payroll.
And what do you see as a risk when, like, for example, if governments decided to deploy these robots on a large scale, and then there could be many risks here, for example, cyber attacks, or even you said that the job shortage is already in action, so it's not even not that much of a problem. But in times of war, for example, like what could be the risks here?
It's a very big question. So there's always risks if you employ new people, if you employ new robots. So that is why I think this awareness of potential risks, whether it's ethical risks, whether it's privacy risk, whether it's liability risk, or even now we are in the startup stage of setting up a living lab with the University Library of Maastricht University. And there we are working, as said, we do with all our robots with an embodied robot, Pepper. Pepper also has limbs, so it has arms and legs, has a face. And we made an overview of what are potential risks. A risk is that a student shakes the hand of the robot and that the hands or the fingers break down.
Yeah.
Or that a student is joking and pours a cup of water over the robot. These are simple risks.
Yeah.
But there's also the risk of the robot giving an advice, and that's why we start with very trivial questions, like what is the Wi-Fi code, or I booked a study spot, where can I find it, or where are the restrooms, these type of questions where this liability risk is really mitigated. And I think that is the way to go, to experiment. So I would really like to make a very strong plea for innovation space and experimentation space. And we need to try out, we need to work in different settings and find out what risks are. And I think that is very important now in this initial research stage, and also in teaching our students how we have to make them aware of what it means, how to co-work, to co-create, to co-collaborate with robots or AI.
Also with AI, like everything nowadays, I feel like everything is a little bit about AI. But here, of course, these service robots could be or should be also employing AI. But also, like, for example, if we deploy these robots, can they be liable also for cyber attacks? So let's assume that something's going wrong in the software or something, or like there is an attack on the system. How big is the risk? How big of a risk it could be in the future?
Let's first make a disclaimer. I'm not a technical researcher, so I'm a behavioral researcher, and we are happy to collaborate with whomever has technical engineering background knowledge. But what I can say, and phrasing it in a layman's jargon, is that the people who really have this technical background and assist us, they make sure that the networks that we are working on are disconnected from the other networks.
Okay.
I think here at Maastricht University we learned a lot from our cyber attack, which was very unfortunate, very discomforting, but a great trigger to set up a reminder, a wake-up call. And I think we are even a role model in how we communicated and dealt with the attack, also teaching others of how to avoid it. And we obviously try to incorporate all this experience into whatever we are doing. But typically the systems we are experimenting with now are standalone, and they don't interfere. So in that sense, we try to minimize the risk of having a bigger impact on the entire community.
Yeah, okay. Let's see what I also wanted to ask. We had a huge pandemic in the recent years, and how do you think, if there would be another one, such a crisis, how would you think that the response of governments could be different when employing these service robots? Could it be because also infectious diseases, so many things could be different if we employed the robots back then?
Yeah, there's a lot of research published based on the pandemic, and also with robots and how robots can prevent contagion. So I think especially in hotels, in healthcare, where supplies have to be delivered to a guest, to a patient, the robot can do that without human contact. Minimizing the contagion risk. If we look at the Olympics that took place in China, they used many robotic systems to make sure that they increase the distance between humans, that they try to decrease or minimize the contagion between humans. And I think all this knowledge can be employed if something like this would happen again. So I think this knowledge base that has been built is really a great asset to pour from. At the same time, I don't have the illusion that the next big thing, whether it's a natural disaster or a pandemic,
of course,
will be of the same nature.
Yeah, of course.
There will still be black spots. At the same time, technology is developing rapidly. So, I think that is also the beautiful thing of contributing to knowledge development, that you can learn from your failures either as a government, as a country, as
yeah.
a university, as a research group, as a student, and use that knowledge to do it differently or to try out something differently. I really don't have the illusion that we will be perfectly prepared for the next crisis.
Yeah, of course, because then it wouldn't be a crisis.
Yeah.
Yeah, and how do you think that these robots could be implemented in third world countries? Because sometimes they lack infrastructure, a lot of things. They would like jump some steps in development, and then they instantly employ these robots. Do you think it could be the future for third world countries, also because of professionals leaving the country, for example, and things like that?
Yeah, I think with every technology introduction, there is a spread across the globe.
Yeah.
And I'm definitely not an expert in developing countries. What I do recall with the introduction of a technology like our mobile phone, I think you saw that development that you mentioned, that it was started in more developing countries, but then less developing countries took over immediately and skipped certain steps and are front runners now.
Also with network development.
Network development, different aspects. And I can imagine that the same would happen with robots or AI at the moment. Our Maastricht Center for Robots did not build up any expertise in that area. What we did experiment with was in the pandemic to see to what extent a robot could mitigate feelings of loneliness. And these feelings were worldwide. So the feelings of loneliness didn't make a distinction between different parts of the world. And we could really see in the situation, and you might still vividly remember that as it was part of your studies, that we were locked down, we were not allowed to welcome visitors, we could not go outside with friends. And then people, and we collected posts, so social media posts worldwide, including developing countries, developed countries, northeast, southwest, rich, poor, completely different. And people really posted that they were talking about, and we used a vector robot for this study. And they posted about the robot as if it was a companion. And so my vector is keeping me company while I'm having my lonely lunch. And they even made like little face masks for the vector robot, showing that they considered it as a human or a social entity keeping them company. So in that sense, I think a robot house, because this is a very small, almost toy-like robot, could already mitigate feelings of loneliness. If you see that on a relatively simple scale, I think the future is endless. We have a hard time imagining what would be possible. And then I think this distinction between developing or less developing is even becoming irrelevant at one point in time.
But also, so these robots could mitigate loneliness. But also on the other hand, some people already say that our generation, the coming generations, are a little bit getting disconnected to each other. And people more growing to developing less emotional intelligence. It's harder to connect with our peers. And do you think that it's a good way to develop robots to mitigate our loneliness rather than to socialize more? I know it's the response to the COVID crisis, but on the other hand, it could be also harmful.
You mentioned a very important thing here. So the loneliness example was an example caused by COVID. We never developed or tested a robot to mitigate loneliness. It just happened because there was a pandemic. And I think what I consider very important in all the research that we do is that we use robots to tackle a challenge or to mitigate a problem. It's not about technology push. We don't want to push robots into the wild and say, well, we have robots, so let's use them. No, we see there's labor shortage. We see people are suffering from loneliness, and they report that the robot is comforting. We did not even plan anything for this study. We just analyzed social media posts that shared these experiences. And I think in that sense, it's really important that we try to understand what can robots do and what can robots not do. And coming back to your concern about a whole generation growing up with too much technology, that makes them suffer from a lack of other skills, I think that is a problem. Right now. In the Netherlands recently, it was reported that our reading skills of our primary school children are really lowest since ever. And is that because they spend too much time on technology? Probably.
Maybe, yes.
Because they use abbreviations in their chats? Is that a reason? Because they hardly take a book to lay down on the couch and read, because their mind works much faster and they need to be triggered every millisecond. Is that probably? But
the attention span is completely different.
We see that also with our students. We really have to be strong and courageous to involve our students. So I think that is a problem. Is the robot mitigating that problem, or is it making it worse? I wouldn't know. But I would like to make a strong plea for technology that helps to mitigate and resolve. In what way? I don't know. I don't have the answer to that, but I definitely see how also now how we are starting a research project with primary school children with the ABI robot, ABII, and II is the abbreviation of interactive instructor. It's a robot of Van Robotics. It's used for primary school children. It's this high approximately, so 1/2 meter. It stands next to the laptop of children in primary school. And it functions as an interactive coach. And this robot helps these children to develop their social skills. And so people who have peer pressure, children who suffer from anxieties, the robot can very gently help them in giving them comfort, making compliments, trying exercises with them. And the same goes for reading and writing skills. This Van robot, Abi, it can really help develop these skills. So that is an example of where a robot does not deteriorate skills, but helps to develop them. And that would be something that I would be really interested in understanding and learning much more about.
But for example, in these robots, like for example, if I ask something from ChatGPT and then it says happy to help, and just for fun I responded, I know you're not happy to help because you don't have feelings. But here, then these kind of robots should have feelings. They should like act as if they had feelings, because otherwise the kids would assume that their peers also don't have feelings at some point, that they can say whatever, and then these robots should also be, because sometimes with emotional intelligence you should also kind of learn to how to deal with hurtful words or uncomfortable situations. And these robots, if they are always going for comforting, then these children might not actually develop these skills. So do you think that there could be also clusters loaded into these robots that actually a little bit aim for discomforting the person on the other side?
Yeah, I get what you're saying. So in the example of a robot that is always cheerful, that was meant as an example. And training students, children to deal with disappointments. So if there is a module that says, well, your friend was not nice to you, how do you deal with this? And then the robot says, wow, very good that you dealt with this in such a way. Or, well, actually, there's also a different solution. Try harder next time, or try this. So I agree with you that the robot should definitely teach or model or role model different types of emotions. But I think we should not forget that the robot is not the only instructor. So the robot is a co-worker of the teacher. And the teacher's role is equally important or more important than the robot. The robot is just supporting or is it just unburdening a teacher who wants to give personalized attention to 30 children in a class. And in that case, I think it can help. So I realized that we haven't solved the answer of how can we train more emotional intelligence, how can we train reading skills that seem to evaporate with the use of technology. Probably what we see is that there is a cyclical effect. There are already primary schools now that have a rule that makes it forbidden to bring a mobile phone. And so that is a response to what we have observed.
Yes.
I think many caregivers, parents are very well aware of the fact that if the use of technology seems to become addictive, that children spend too much time behind their computer, game console, robot, whatever, that they make restrictions. And I think it's a responsibility of a society. It takes a village to raise a child, and I think that's also true here. And so we cannot only blame technology for showing this undesirable behavior or there's this lack of certain skills. I think it's also us as teachers, as parents, who really have to stand up and take our responsibility in educating our children, our students, our pupils.
Yeah, exactly. So do you think that it's also a danger that these children who learn with these robots or like cope with these robots, they might develop these emotional connections, and when time comes to say goodbye or the robot is harmed or something, it's out of order or something, then it could also harm the soul of the children, that they're too much connected to something that is not human-like. I mean, it's human-like, but it's not a human. So do you think that some parents, for example, wouldn't like that for their children in school?
Yeah, I think this form of attachment to a non-human thing, that is of all ages. I don't know about you, but I used to play with dolls when I was a child. And I was really a caring mother as an 8-year-old, taking care of my little doll. And I got attached. And one day, I'm not making up this story, my mom can be the witness of this. This doll was stolen because we came home from a holiday. I put it in front of the house. We were bringing the suitcases, and then my doll was gone. I really had to cry for days in a row. My mom even posted a vacancy text in the local magazine asking, it's not a vacancy, an advertisement, whether someone saw my doll with a picture. So what's different with a robot? It's the same.
You're
so you
right.
can some people are really attached to their cars. I'm not. But so and if it got a scratch or in an accident, people are devastated, not only because of their financial loss, but because of their beautiful car. So that's not
and what
different
if,
now.
For example, the software is saved. We just buy a new body, a new host for the software, for example, so they could live longer than a car, for example, because a car, you are like attached to the hardware, but here you're attached to the software more, right?
Yeah, I'm not sure. I think it's being attached to something, a human, a robot, a doll, a phone, that is of all ages, and this attachment is something. If you talk about resilience, and we have to teach children also to deal with this, I think it's also about expectation management. A doll can get lost, a robot can break down, but obviously you can buy a new one, or it can be replaced or charged or whatever. I think that is important. So I think that the key lesson here is that we have to train users of robots to be responsible users and be aware of what it can and cannot do. Have to be realistic in expectation management, that they know what to expect. And for young children, very young children, I think we also have to work with people who are strong in pedagogics or strong in didactics that help us. We are not. So that's also why the Maastricht Center for Robots is really reaching out to other disciplines to team up and make sure that we cater as best as we can to the needs of that specific target group.
Yeah, and just coming back to a previous question, when do you think that these medical or healthcare service robots are going to be introduced on the market for private use?
Well, they can already be purchased for private use. So the answer would be that time is now.
Okay.
I have no numbers or statistics on how frequently it is used, but it is used in elderly care centers, but also in smaller wards. So in that sense, it can also be and is most likely also used in private settings, but we simply are not experimenting there or experimenting doing research in that context. So I can't give you more specifics on the details here.
I mean, I think at some point everybody's going to be taken care of by robots. So at some point we're also going to experience that ourselves, either in hospitals or at our homes. But to just wrap up this episode, would you, just a last question, would you also buy these service robots for yourself at home? So when it comes that any health issues or something like that, would you also buy it for yourself?
Absolutely. For myself, for my loved ones, I think if it would help our daughter in her studies, I would definitely try to buy or invest in a robot. If one of our parents would be helped by a robot, but that gives them structure or any other type of help, why not?
Yeah.
We also bought them a tablet and a phone and any other technology, a dishwasher to make their lives easier.
Yeah.
So I really personally don't see the difference with a robot. It's just technology.
Yeah, it's just another function of...
It's another function. It can have a functional role, but also a social role. Many of the other technology, if we talk about a dishwasher, well, I can be very happy if my dishes are done, but it's not a social entity.
Yeah, of course. Yeah.
But with a robot, it can also have this social role of mitigating loneliness. So if technology can do both, I would definitely consider that, yes.
Yeah. Yeah, I think I would too, yeah. It would make, I think, everyone's lives easier at some point if we knew that we have this technology.
And we are trying to solve wicked problems. Loneliness is a wicked problem. Giving someone structure in a day is a wicked problem. And we can say, well, we need a nurse that is 24/7 present, or we have a nurse and a robot that co-create, that collaborate, which makes sure that the nurse doesn't need to spend 24/7.
Can have some rest.
Can have some rest or do some other responsibilities. And in that sense, I think this triad of user, caregiver, or teacher, and robot, that is an important triad. And all the dilemmas, we even called them trilemma in one of our papers, they have to be tackled, and that is why research is so important. Yeah,
at the end of the day, maybe these robots could be the answer to aging societies that many countries face now.
Yeah, it's not the only solution, it's not the only answer, but they definitely get a role. Yes, I'm convinced of that.
Yeah, of course. Okay, thank you very much for coming in. I think we had a really nice discussion about service robots, especially in healthcare. And for sure, there are many more questions to ask. And thank you for tuning in. We're going to continue in a month with our next episodes.
Fantastic. Thank you so much for this nice conversation indeed. And we invite all our students, collaborators, researchers from other universities and other faculties to join us in this beautiful research endeavor.
Thank you very much.